Good morning, dear colleagues. Today's theme is the diaphragm. What is the thoracoabdominal diaphragm? The term diaphragm means septum, and in anatomy we know several diaphragms. For example, diaphragma oris, which is the floor of the oral cavity. Diaphragma urogenitali, which is the floor of the abdominal cavity. And now we are speaking about thoracoabdominal diaphragm. That means a septum between abdominal cavity and thoracic cavity. In this picture, we can see this septum from abdominal cavity. Thoracic cavity is above of this diaphragm, but it isn't demonstrated here. So here it is, the diaphragm, thoracoabdominal diaphragm. So because it is septum, it has several layers, and the main layer is musculus phrenicus, the muscle itself. This muscle is chief muscle for breathing. Due to this muscle, we can make inhalation and exhalation. And what is the structure of this muscle? It consists of three parts. One of it, number 1 in this picture, is pars sternalis. It means that it starts from the sternum, from processus xiphoideus. This is smallest part of thoracoabdominal diaphragm. It has triangular shape and it's placed in front part of the diaphragm. In the central part of the diaphragm, we can find centrum tendinum. The diaphragm has a serious feature which differ it from another muscles. It originates on the bones, sternum, on the ribs, on the vertebra, but its insertion is in central part of the diaphragm and looks like a mirror. Sometimes they say that centrum tendinum is a mirror, tendinous mirror of diaphragm. So centrum tendinum is the unusual tendon which can, during contraction, make the diaphragm flatten it. So centrum tendinum is the tendon of this unusual muscle, musculus phrenicus. Then number 3, what is it? Number 3 is pars costalis. We already have said that the diaphragm, the musculus phrenicus, consists of 3 parts. So, pars ternalis, the first, pars costalis, the second, and pars costalis originates from the ribs, from 7th till 12th. So, this is most large part of musculus phrenicus is pars costalis, which is laterally placed. And number 4 in this picture is opening, one of 3 main openings, which placed inside of centrum tendinum. This opening serves to make connections between thoracic cavity and abdominal cavity. So through this opening, foramen venae cava inferioris, the most large venous vessel passes from below, from abdominal cavity to above, into thoracic cavity, into heart. So, number 4 is foramen venae cava. Venae cava inferioris, because we have 2 large venous vessels with such name, vena cava superior, which make drainage, venous drainage of upper part of our body, and also head and neck and upper extremities, and vena cava inferior, which make drainage, venous drainage from lower part of our body and lower extremities. So, foramen vena cava inferioris take place inside of the tendinous center of diaphragm. That's why during contraction, this opening will not change its shape, so it couldn't influence to the diameter of vena cava. It's very important thing because the walls of venous vessels are quite thin, and it's difficult for venous vessels to resist to external pressure. Then number 5, another opening, which called hiatus. Excuse me, it's mistake. We shall change it. Hiatus esophageus. Hiatus esophageus. So number 5 is hiatus esophagus. What is esophagus? Esophagus is part of gastrointestinal tract. So it's muscular tube which connects the pharynx in the throat with stomach in the abdominal cavity. So hiatus esophagus we can find inside of muscular part of the diaphragm. In comparison with foramen vena cava inferioris, it is surrounded with muscular fibers. So these muscular fibers also helps to serve as a special sphincter. You know that it's very important for function of gastrointestinal tract that the content should pass only in one direction. When we swallow food, it would be good if it will pass only from pharynx into esophagus, into stomach, into intestine, but not in opposite direction. The opposite movement of the gastrointestinal content calls reflux. Reflux. And it's pathological situation. Sure, it can take place quite rare in healthy persons, but nevertheless, it's unpleasant situation. It isn't good for health. So this shape of hiatus esophagus helps to the content of gastrointestinal tract, content of esophagus, to move only from above down, from neck to the abdomen, and not in opposite direction. And also, let's compare. Number 4 is foramen vena cava, and number 5 is hiatus esophagus. What does it mean, hiatus? It means gap. This is opening in round shape, but gap is, hiatus is gap with a narrow, very narrow shape. So, hiatus esophagus is second from 3 large opening inside of the diaphragm. And now let's find what is number 6. Number 6. Number 6 demonstrates us pars lumbalis, the diaphragm. So the diaphragm, we have said, consists of 3 parts. So it originates from 3 different parts in circumference of the thorax. So pars sternalis, number 1, pars castalis, number 3, and pars lumbalis, number 6. Why such name, pars lumbalis? Because it originates from lumbar vertebrae, from corpus of lumbar vertebrae. It originates by 2 large crura. crus dextrum, number 12, and crus sinistrum, number 11. And then these crura they pass laterally and form two special arcs. And one of them, number 7, we can designate as ligamentum arcuatum mediale. I said they form arcs. So these arcs serve for muscles which pass under it. So number 7, ligamentum arcuatum mediale, is a special ligament which surround from anterior side this muscle. What is this muscle? It's musculus psoas major. Musculus psoas major. So we can say that ligamentum arcuatum mediale surrounds musculus psoas major from anterior side. So it's left ligamentum arcuatum mediale, and this is right ligamentum arcuatum mediale. They especially remove from here, from this place, musculus psoas major, for we can compare the situation without this muscle on the right side and with presenting musculus psoas major. So number 7 is ligamentum arcuatum mediale, and you can see here arcus medialis. This is medial arc which serve for musculus psoas major. And number 8, what is number 8? Number 8 is hiatus aorticus. Again, I repeat that through the diaphragm pass 3 large structures, and for this purpose they use the openings. So number 4, foramen vena cava inferioris, number 5, hiatus esophageus, and now number 8, hiatus aorticus. This gap serves for passing of aorta. Aorta is the main and most large arterial vessel which serves for blood supply of all organs of our body, and it passes through thoracic cavity into abdominal cavity in this gap which called hiatus aorticus. So this is hiatus aorticus. By the mean, it isn't seen here, but I'd like to say that between two crura, crus dextrum and crus sinistrum, which are the main structures of lumbar part of diaphragm, we can find also here ligamentum arcuatum medianum. Number 7 is ligamentum arcuatum mediale, which is paired, right and left, and between two crura surrounding hiatus aorticus, we can find ligamentum arcuatum medianum, which is impar. So ligamentum arcuatum medianum serves to prevent the influence during contraction to aorta. So blood supply should be constant, and any external pressures isn't good for constant blood flow. And now number 9. Here it is, number 9. I shall use special pointer. Number 9. Number 9 is ligamentum arcuatum medianum. I have said that it isn't seen here. It isn't good. It isn't good demonstration of it. Ligamentum arcuatum medianum should be placed on the median plane, but here it's demonstrated on the left cruise. It isn't quite correct, so it's only part of ligamentum arcuatum medianum, but nevertheless we should say that ligamentum arcuatum mediana is a special ligament which connects two crura, crus dextrum number 12 and crus sinistrum number 11. And now number 10. Here it is, number 10. What is it? Remember, number 7 is ligamentum arcuatum mediale. So, what is number 10? Number 10 is ligamentum arcuatum laterale. So, crus dextrum prolongates to the ligamentum arcuatum mediale number 7, and then it prolongates into ligamentum arcuatum laterale number 10. So these two ligaments surrounds from anterior large muscles. Ligamentum arcuatum mediale surrounds musculus psoas major, here it is, and ligamentum arcuatum laterale number 10 surrounds musculus quadratus lumborum. Here it is. It isn't designated as a special number, but I demonstrate you now. Here it is, musculus quadratus lumborum. So, ligamentum arcuatum laterale surrounds it from anteriorly. Again, on the right side, this posterior abdominal wall is without large muscles, and left side has these large special muscles, musculus psoas major and quadratus lumborum. So these two muscles locates being covered from anteriorly by these two ligaments, ligamentum arcuatum laterale and ligamentum arcuatum mediale. Now, number 11. Number 11. What is it, number 11? It's crus sinistrum. and number 12 is crus dextrum. So we can say that lumbar part of the diaphragm starts with these two crura, crus dextrum and crus sinistrum. They look like ligaments, and this is sort of tendons which starts from the lumbar vertebrae, from the corpus of lumbar vertebrae, from first three lumbar vertebrae. That's why this part of the diaphragm calls the lumbar part. And it's quite important to say that usually right crus dextrum, number 12, is more longer and more large than left crus, than crus sinistrum. And again, I'd like to remember that we are not clones. That's why we are different from each other. And moreover, our right and left parts are also different usually. So we are not completely symmetrical. Practically each of us has some kind of asymmetry, and it concerns different examples. The shape of the hands, shape of the our face from the right side and left side, and also now we can see that crus dextrum and crus sinistrum are similar, but nevertheless they have different shape, and one of them is more large than another. It's common anatomical rule. Okay, so in this picture we discuss the thoracoabdominal diaphragm. We look it from below, and now we shall try to look at the thoracoabdominal diaphragm from above, from thoracic cavity. So another picture, view from above to the thoracoabdominal diaphragm. Here it is. The back of the patient is here. We are looking from the head, from the thoracic cavity. The anterior part of the chest is here. The ribs are here. So the patient is lying on the anterior abdominal wall. So we can find all the structure from here. First of all, I'd like to begin on the order from number 1. What is number 1? Number 1 demonstrates us the aorta. Here it is, the aorta. And we can see that aorta passes through the diaphragm. It is lying on the anterior part of corpus vertebrae, but not in central position, but from the left side of it. Then we use this designation number 2, which demonstrates us the muscles of the back, exactly musculus transversospinalis. It's muscle of the back which helps us to be in vertical position and to turn our body. And number 3, here it is. It's another muscle, musculus erector spinae. The name demonstrates us the function that this muscle helps us to be in erect position, to be standing vertically. And then number 4, it's again today's theme, muscles of the back. Number 4 is musculus latissimus dorsi. Musculus latissimus dorsi. Here it is, musculus latissimus dorsi. And then number 5 is musculus serratus anterior. Serratus anterior. It's muscle of the corp on the lateral side of the chest. Musculus serratus anterior. Then number 6, this is centrum tendinum. You can recognize that it looks like to live in any execution plant, or maybe an ears of some animal. So, centrum tendinum is the part of the diaphragm in which is placed from thoracic cavity the heart. So here we can find a heart, and then number 7 is musculus obliquus abdominis externus. Here it is, musculus obliquus abdominis externus. And number 8 is musculus erectus abdominis, muscle of the anterior abdominal wall. And then number 9 is pars sternalis of the diaphragm. So we can see that pars sternalis is quite small part. Then number 10 demonstrate us the ribs, costae, and number 11 demonstrate us the costal part of the diaphragm, pars costalis diaphragm. So pars costalis diaphragm is most large part, and the lumbar part is less than costal part, and lesser part is pars sternalis diaphragm. Number 12, here it is, number 12. What is it? It's vena cava inferior. So we can see that vena cava inferior is passing through the diaphragm on the centrum tendinum. Number 13 is musculus trapezius, and number 14 is esophagus. So this is complete picture which demonstrates us the all details of diaphragm from above. And now we shall understand its structure. So, another question. Layers of the thoracoabdominal diaphragm. Layers of thoracoabdominal diaphragm. So, we can list all the layers from above down. We shall say that diaphragm itself is a septum between thorax and abdominal cavity. And that's why when we are listing it from above, the first more superior layer is serous sheet which covers from inside the thoracic cavity, pleura. Then number 2 is fascia. Fascia endothoracica. Fascia endothoracica. We can say that it's a continuation of the fifth fascia of the neck. It's a continuation of the fifth fascia of the neck. Fascia endothoracica, it also covers thoracic cavity from inside, and that's why it also covers the diaphragm. And superiorly, it is continuated into the fascia prevertebralis of the neck. Then, musculus phrenicus itself, musculus phrenicus, the main layer of the diaphragm, musculus phrenicus, chief muscle of the breathing. Then, number 4, fascia endoabdominalis. It has another name, fascia subperitonealis. Fascia endoabdominalis or fascia subperitonealis. And we can say that this fascia is analogous to the fascia endothoracica. But fascia endothoracica covers from inside thoracic cavity, but fascia endoabdominalis covers from inside abdominal cavity. And the most inferior layer, the last fifth layer, is peritoneum, the serous sheath of the abdominal cavity. Peritoneum. So, now we know that the diaphragm, thoracoabdominal diaphragm, consists of 5 layers, and the most thick, most important layer is musculus phrenicus. And now the question about weak points of the diaphragm. Weak points of the diaphragm. What does it mean? It means that there are several points on the thoracoabdominal diaphragm where we can't find musculus phrenicus. Here it is one of it. Between lumbar part and costal part, there is triangular in shape place where muscular fibers are absent. It's named trigonum lumbocostale. Trigonum lumbocostale. According to author who has revealed this structure, it named as Bohdalex trigonum. Bohdalex trigonum. Trigonum of Bohdalek. And there is another analogous structure, trigonum sternocostale. Trigonum sternocostale. Sure, they are pairs, so we can find from the left side and from the right side. Trigonum sternocostale is placed between sternal part and costal part of the diaphragm. And according to the author's name, we can say it's space of Larrey's or space of Morgagni. Sometimes they speak that Larrey's is right space and Morgagni is left, but it's difficult to distinguish. We can say that it's synonyms, spatium of Larrey or spatium of Morgagni. So, what is special in this position? We can say that in weak places, muscular layer is absent. Therefore, there is a risk of diaphragmatic hernias because of lack of the muscular layer. So, I remember all 5 layers, and I'd like to demonstrate that muscular layer is absent here. That's why there are some very serious clinical situations which could be demonstrated in these pictures. So, what is this? we can see that some structures from the abdominal cavity enters through these sternocostal spacia, sternocostal triangles into the thoracic cavity. We can see here the part of intestine and part of the stomach. So it's very dangerous because of it could be result a serious pain and ischemia and then necrosis. So without any surgical treatment, it's very dangerous for life. Another example. Here it is picture which demonstrate as from abdominal cavity the part of the stomach enter to the thoracic cavity, and you can see that it's placed close to heart, and that's why it also can be difficult for normal function of the heart. And here it is, the X-ray examination of the abdominal cavity using a special contrast substance which was injected to the intestine, and we can see this part of intestine which is entered to the thoracic cavity. And now another more contemporary investigation using computed tomography, and be attentive to this place in red circle. In right part, I use the magnitude of it, and we can see that this is a sternum, and this is the heart, and in the place between thoracic wall, anterior thoracic wall, and the heart, some organ entered into the chest from Lares triangle. So it's examples of diaphragmatic hernias. Now another question about projections of the domes of the diaphragm on the chest wall. We can say that the diaphragm has two large domes, right dome and left dome. During contraction, they becomes flattened, and that's why the volume of the thoracic cavity increase, and we make an inspiration. And when musculus phrenicus relaxes, so the diaphragm return to the its normal position, the domes becomes in its normal place, and there is a question. According to the ribs, where are the localization, the projection of domes to the anterior wall of the chest? So we can say that right dome is projected into fourth intercostal space. Fourth intercostal space. For understanding, we can say that in male, the nipple is located exactly here, in fourth intercostal space or in fourth rib. So, practically, the diaphragm projection from right side coincide with the nipple position. And from the left side, we can find that is placed on one intercostal space lower. So left dome is localized in fifth intercostal space. In fifth intercostal space. It's interesting also to add that here in fifth intercostal space, we can palpate a heartbeat, because exactly here, localized, so named apex cordis, apex of the heart, practically being localized on the centrum tendinum, the heart positioned its apex here in fifth intercostal space, so we can palpate it and understand where is the dome of the diaphragm from left side. It's very important information when we examine the patient and try to imagine ourselves where are the domes of the diaphragm. Quite high, they placed quite high, and that's why only this place is occupied by the lungs. So lungs during inhalation should be enlarged, and during exhalation should be diminished in the size. And the last picture demonstrates us the projection of the diaphragm in the phase of inhalation, exhalation. So during inhalation, the diaphragm moves down, and during exhalation, the diaphragm moves up. In inhalation, it is flattened. In exhalation, the domes are quite high. So, thank you for attention.
Запись остановлена уже, да? Не знаю, как может быть.